Welcome to Adapt NCLEX. Let's talk about hallucination for the NCLEX. Very important topic. I think you would like to stick around and hear what I have to say. This is one of the areas people have questions and they have been making mistakes when they do Cuban questions. It's a very IO topic and your board know that. So they will ask you multiple times. One of my students asked me, he said, why I keep on making mistakes every time they ask me about hallucination. I answer this question, but always I'm getting it wrong. What is the problem? So let's get the content, the reason why. Okay, this is one of the most commonly mixed question on the NCLEX. Okay, based on what I can tell from the Cubans, people mix it in the percentage of questions. Um, you can see how many people miss that question because it's very, very easy. What is the problem? Why? It's because we treat everybody hallucination as the same. Okay, we treat people who have hallucination as always the same thing, the same scenario. No, it's not the same. Don't treat them like that. Anybody who is hallucinating does not need to be treated the same. Have you had the same question where they give you a question about hallucination? And then what do, you have a question, okay? The question is it's talking about hallucination, basically. And then what do? You answer the question, you say, oh, the common one we all know is reality. Ensure that the patient, provide reality for the patient, okay? And then they said it's wrong. They give you another question, and then you redirect. And then they said it's a wrong answer. And they say, what is the problem? Initially, I said reality, you said is wrong. I redirect the client, you said is wrong. And then you see another question about hallucination, you said you change your mind. You said, okay, let me reassure the client. And they said that one too is wrong. You see, they all look the same. Reality, redirect, reassure. What is the problem? Why are you keep on answering the same question in a different way or sometimes the same way and you get it wrong? Hallucination can be a reality problem. That's your answer. Or it can be redirect problem. It can be reassured problem. You have to reassure the patient. What is the issue that you should pay attention to? I call it the buzzword of the question. You have to pay attention to the buzzword. The examiner is putting a concept in that buzzword. So that's where your target will be. Not every patient who is hallucinating should be treated the same. The key buzzword is look for whether the patient has dementia. That's number one. If the patient has dementia, you treat them differently. Number two, are they delirious? So do they have delirium? That's the second one. Pay attention to the buzzword and look for the dementia or delirium. And the third one is psychosis. Do they have psychosis? That is why they are hallucinating. If they are doing that, then the whole ball game changed. And you can see that these three things are not the same. Therefore, your hallucination answer choice should not be the same. It should not always be provide reality. It should not always be redirect the patient. It should not always be reassure the patient. It's all based on the scenario. So that is the key why people make these mistakes multiple times. And it's the most commonly made side question because you always know we got to do reality, but then you forget that the key is the individual you're taking care of. So let's look at it. The client told the nurse that there are people in the walls plotting to kill me. What is the nurse's best response? Before even you answer this question, you have to ask yourself, what kind of client? Who is that client? I intentionally left it behind because the client become the buzzword. And who is that client? If you figure out that client, and then that will tell you what you need to do. So let's assume the client we're talking about has dementia. The key example is you have Alzheimer's patient, right? This client has Alzheimer's. So replace the client with Alzheimer's. A client with Alzheimer's told the nurse that there are people in the world plotting to kill me. That changed the whole scenario. That concept changes. And now you know that this patient, he has what? Dementia, some memory issue, does not know what she's talking about. She may be hallucinating, but there's underlying problem you have to address. For this patient, why are they saying that? Your response should not be the same. Say, or provide reality to the patient, or reassure the patient, or what? What is the next one? You reassure, provide reality, or basically you you basically reassuring them and giving them safety. No, that's not the thing you're supposed to do. It's different, right? So for this patient, all you have to tell the patient is because it's Alzheimer's disease, you tell them, I see that you are scared. So you acknowledge their problem. Let's go to a place that you can feel safe. You can feel safe. So that's what you are providing to that patient. You are redirecting the patient, redirecting them so that they know that what they're seeing is not relative, but you can't use the thing and say, oh, there's nothing there. No, they don't know. Safety is their major issue. So I see that you're scared. Let's go to a place that you can feel safe. You redirecting them. You are not ignoring what they're saying, redirecting them to something that is important. So you provide some safety and they will be more comfortable talking to you. Assuming that client, okay, is a 50-year-old or somebody who is an alcoholic, okay, is an alcoholic. He's been in the hospital for 5 days. Now he's going to withdraw. He's going to withdraw, right? So he's withdrawing basically, and he's showing signs and symptoms of withdrawal. Okay, he's withdrawing. Acute phase. They will be hallucinating. They will be a visual hallucination, tactile hallucination. That patient, you cannot say, let's go to a place that is safe. You can't do that. You can't do that. You have to think about something here. So that's the difference between that patient. So you know for this particular patient, it's something that causes the problem, right? What causes the problem? The problem is the alcohol withdrawal. So that patient, you have to like do something different. We reassure this particular patient that, oh, I see that you are scared or afraid. This feeling will go away. It's because of your underlying condition. So it will go away when the withdrawal symptoms goes away. So you just reassure him whatever he's seeing is not there, but it's going to go away when he get better from his problem. Okay, so that is the different. So reassurance. And the third one is important. That's why I'm taking my time explaining it so that you can get it. And the third one, if this patient has like schizoaffective disorder, schizophrenic, okay, and it tells you that there are people in the world plotting to kill me, is a different problem. You can't tell them, redirect them, let's go to a place that you can feel safe. No, let's go. I see that you scare, and then this will go away. It's not going to go away. He has a schizophrenia. It's not going to go away. This patient require reality. I understand what you're saying. Acknowledge their feeling, but I don't see anybody in the world. That is your what reality establishment. So for all of the three, you cannot answer all the questions. You have to figure out what they're talking about. If it's somebody with dementia, yeah, you have to redirect the patient, redirect them, but don't ignore their feeling in terms of the hallucination. If it's related to alcohol or any other thing causing it, you have to reassure them underlying medical problem causing that. But if they have schizoaffective disorder, their thing, there's nothing you can reassure them about. There's nothing you can redirect them. You have to provide reality that, A, what they're saying is not there so that they can understand it. That is the difference between these three problems: hallucination, dementia, and alcoholic problem. Um, all of them having this problem. So if they have a hallucination, they have dementia, they have a alcoholic issue or schizophrenic, your treatment should not be always reality. It should not be always reassurance. It should not be always redirect based on the buzzword, which is the individual client that is involved. That's the way you attach them. So according to 3 hours, redirect, reassure, reality for hallucination. But you have to know which kind of patient you're dealing with. Take care of yourself and have a good day. Bye.